Fibrous pericardium.
It's outside,
Parietal.
inside. Visceral on the organ.
Myocardium.
Right here, muscle.
And endocardium.
The inner, inside, these stuff. Right
White surface, right in there.
Yeah.
The white surface, endocardium. Okay. And then next, we'll just move through the list.
Wait, what was that?
Okay, go.
Endocardium.
Endocardium.
And then myocardium.
It's muscle. You can tell.
Myo.
Yeah, the meaty part, right?
Yeah, where it looks like you can eat it.
Yeah, exactly.
You never eaten a heart?
Have
No,
you?
it's good.
Yeah.
Have you eaten this heart?
Yeah. Well, I mean,
The chicken heart. Oh, I love.
Everyone eats chicken heart.
Yeah, I
The
love
sheep
it.
heart, I heard is good.
Hearts and
Don't
gizzards.
they put that in like
Gizzards.
pho?
Yeah, it's
What is?
good.
is
So what's
they put, like,
next?
some
Alright, we're
kind
getting
of
off
thing.
topic.
But anyway,
Let's do this.
I don't know what it is, but it looks.
What are you pointing at?
That's
No, I'm just saying
Myo.
what's next.
Okay.
Oh.
Right
Endo.
atrium?
No, epicardium now. We didn't do epicardium.
Yeah, we did. It's outside.
Oh, I'm
Epis are
sorry.
outside.
Sorry.
That's epi.
It's gluten in the front.
Right atrium?
Right atrium. Okay, so what's right and left?
This is
don't
left because it's
Okay.
bigger, and this is right because it's smaller.
So ventricles, and we got to come up to here.
Yeah, it's kind of hard to see those parts. I'm really
Yeah.
confused. Did we not cut it good?
No. As long as it's in half, it's it. Oh, right in here. Yeah, this is. I mean, it's cut in half, so you got a part of it. But yeah, that's right in the space of the
Oh.
right atrium.
I guess that's really easy if there's a pin on that because no, it's really too small.
Or here's a little more of it up here. Yeah, right atrium. Just kind of opening it up.
So you should be able to go to.
So how are you gonna like show that on the lab exam?
Just,
Yeah, we just pin it right in here.
Oh, okay.
How do you know? It's like, oh wait, never mind. That was a stupid question.
Okay.
I was like,
She
wait.
thought about
She
it
took
before
it
you
back.
Mhm. All right, so let's just move through the list. Go stars. Okay, so
Tricuspid
spread it open,
Tricuspid.
valve.
and you got the valve right here that I'm poking at. Let me get that out the way.
Oh, that's not it.
Yeah, right in here.
Oh.
And a
Whoa.
good thing to look for is you got your little strings, your chordae
Chordae
tendineae,
tendineae.
and then the wider flap. That's got to be our AV valve. Tricuspid, because we're on the right,
Tricuspid.
and then it leads down to our chordae tendineae.
Chordae pendant.
We could use like any name for that.
And then the
right?
papillary,
Tricuspid,
and then
right,
papillary
AV
muscle.
valve.
Isn't
Papillary
it connected
muscle?
to at the end of the chordae tendineae?
Yes, and I think it'll just be easier to see on this side. This
Okay,
is the
well-
bicuspid valve. Bicuspid valve,
It says two.
and chordae tendineae, the string, and then see the big bulge it connects to.
Oh.
That's
Papillary
a good
muscle.
papillary muscle.
Okay.
Got
Anything
it.
bulging.
Well, chordae tendineae always have to go right to it. Okay.
Where's it on that side?
Well, this side, I mean, since it's kind of tucked around and it's right where you cut, basically.
Okay.
Okay.
Next down the list.
Interventricular septum.
Oh, that's easy.
The
Interventricular
thick part,
septum.
Yeah, the
middle,
big, thick middle.
interventricular.
Chordae tendineae.
Chordae tendineae.
yeah,
so
we
we
got
already
that.
mentioned that.
We got that.
Next.
We have the
Let's do it.
papillary.
Next.
Right ventricle.
Right ventricle's the space here.
And
Left
papillary
ventricle.
muscle, which we did.
No, we didn't.
Right,
Pulmonary trunk.
right ventricle.
No, we did.
Right
ventricle.
ventricles, that space.
And then pulmonary trunk.
All right, so we want to go from the right ventricle and we want to get out of the artery. So here's the pulmonary trunk. I have my thumb on it. And what I'll do is I'll just take the probe, I'll push it through the pulmonary trunk.
I told you, bro.
That's what I'm
Wait, is there a
doing.
squirt?
Oh, no. And where am I going?
Nobody knows.
Where you going?
The left. No, the left.
Are you lost?
Because that should cut a hole in
There we go.
hole in its heart.
I don't even know where it is right now.
I can't even find it.
No, I see it. I just don't want to damage the heart. There you go. So you see you got the probe there in the right ventricle. And from the right ventricle, exiting out the pulmonary trunk.
So this is the pulmonary trunk.
Where's the inside, Professor?
Damn,
I need-
it's really
I need-
hard.
Wait,
to
but what's it
tell.
exiting?
Where's
So
the nerve?
going out of the right ventricle,
Okay.
Okay, that's the pulmonary.
the right ventricle leads out to the pulmonary trunk.
Okay. What's next?
Pulmonary trunk.
Aortic semi-lunar valve.
Okay,
Aortic
so
valve.
you got the left ventricle, correct?
Mm-hmm.
And you notice the AV valve with the chordae tendineae.
Mm-hmm.
The left ventricle is going to go out to the aorta. But first, we're going to have our aortic valve. And we're going to have a little flap of it somewhere. There you go. That's a little piece of the aortic valve. This is the aorta.
Mm-hmm.
And right there,
Aortic
a
valve.
little piece of that aortic valve right there.
Okay.
So from the left ventricle, aortic valve, this little section of it, and then out to the aorta.
Aorta.
It's aorta.
Okay. It's more.
And on this side, let's see. Yeah, here's probably a better view.
Oh.
Left ventricle coming out, and here's now a good section of the aortic valve, and then that remnant of the aorta. You got most
Aorta.
of it on this side. Yeah, aortic valve right there.
Aortic valve.
Pulmonary vein.
Pulmonary veins. So pulmonary veins have to go into the left atrium, correct?
Mm-hmm.
And so we just need some veins, because we know we're on the left side again. Should be right in. Whew. So there we are going into the left atrium. Left atrium. So pulmonary veins, they're cut really short. Left atrium. And left atrium. What's this valve here?
Bicuspid.
Bicuspid valve, and the strings connected.
Chordae tendineae.
And then the bulge.
Pulmonary or papillary muscle.
All right, so where does that put us on our list? We're in the left ventricle.
We did bicuspid already, right?
Mhm,
Yeah.
Bicuspid.
Then we did left ventricle.
Left ventricle.
Right and left pulmonary arteries.
No.
Yeah, we-
Like
Trabecular carnea should be
we're
the
on
last
here.
thing.
Sorry.
So all you got to do really is just take the ventricle and kind of spread it open. I think the side might look better.
Oh, there, I see you going. Yeah, like that, right? This against the wall.
Any of the branches, as long as it's not a papillary muscle with the chordae tendineae connected to it, but really pulling it apart right there, these branches, trabeculae carneae.
There are branches.
Branching muscle inside the ventricle. There, trabeculae.
And we're-
Ligament.
we did the pulmonary vein, but we're the pulmonary arteries.
Thank you.
Well, pulmonary trunk.
Oh, it's in. Okay.
And then only when it splits do you call it.
Did we do the semi-lunar valve
Stupid
already?
me.
or-
Yeah, that was
Yeah.
aorta.
Like,
Semi-lunar valve.
Okay. Thank you.
What time is it?